Thank you so much, Mr. Chair, and I thank all of our panelists. And, unfortunately, I was not going to start my questions this way, but I just want to clarify some things that from my colleagues. First of all, I am a proponent of COVID-19 vaccines. I've been vaccinated. I gave vaccines and attended vaccine clinics in all 24 of my counties. Early on in the pandemic, and when we first had vaccines available, there was not as much research and data we have available about natural immunity as there is now. So if I may say, being a proponent of acknowledging the benefit of natural immunity, which does not mean people should go to COVID-19 parties and get infected, but to recognize that immunity is what we should be talking about, whether it is immunity from a vaccine or immunity from natural disease. And then that way have vaccines available for those who need vaccines, and also to treat and send to other nations so that their population can have an increased level of immunity so we can get through the global pandemic. So I just want to clearly make that statement that we should be talking about immunity. We don't want anybody to get ill or to get sick, and also to clarify that, yes, people who are vaccinated can come down with COVID-19, as can people with natural immunity. So having had a vaccine does not necessarily confer that you will never contract a disease, and that's true for all infectious diseases. Furthermore, we should also be talking about having people have proof of their immunity. So I would encourage my colleagues to support a bill that I'm producing to mandate the coverage for T-cell immunity, so that humoral immunity, which may not be long present in the bloodstream, but there is T-cell immunity for viruses, so we can prove immunity. And that way, keep everybody in the workforce rather than only talking about vaccine mandates, would send some people out of the workforce. So again, was not my intention. So I'm going to ask the panelists to be very brief in their comments, if I may. Dr. Chazenbach, you have written extensively about the negative impact of school closures on our students. Your research also found that they impacted low-income students, and also in reference to food insecurity. So is that correct?
Yes, absolutely.
And
we've really hurt our children.
Yeah, and you also mentioned that during these school closures, there was less access to school lunch programs or other food programs that the school may have. And so that too led to a negative impact, especially in our low-income and minority students.
Yes.
Yeah, and that also related to a slight decrease in the level of poverty in our students. And so while these extraordinary pandemic measures have slightly reduced poverty in the United States, the World Health Organization has said that worldwide poverty in children has increased over 15% and may take decades to reverse. And the school closures not only had an effect on food insecurity, as you had indicated, but they also had a tremendous effect upon the loss of grade level and also mental health disorders. So based upon your research, I would think certain governors, mayors, school boards chose not to let teacher union keep schools closed and put tens of thousands of our children at risk. And their failure to reopen schools has directly led to kids going hungry, and it's endangered both their mental and physical well-being. So I thank you for that research, which has helped change decisions to keep students out of the classroom and jeopardizing our most vulnerable. If I could ask all of the panelists, and I know my time is running short, Dr. Chazenbach, do you believe that there is inflation? And are you worried about inflation?
Yes. So I'm not a macroeconomist, but I've studied up on this.
That's okay. I don't mean to cut you off, just yes or no. I want to go to all the panelists.
Oh, sure.
Dr. and Reverend Wilson, are you concerned about inflation?
I believe there's inflation. I worry about children.
Okay. Mr. Duda Gupta, are you concerned about inflation?
Yes, unfortunately, all the evidence suggests it's transitory.
Okay. Transitory, which I asked the Fed chair several months ago. Now we're in 8 months of inflation. Mr. Schaefer, are you concerned about inflation?
I think it is something that we should watch, but also something we should have expected with.
Thank you so much. Mr. Holtz-Eakin, are you concerned about inflation?
Yes, I am.
Yeah, as a matter of fact, inflation has eaten away at the benefits of rising wages. We've seen beef up, eggs, price of eggs, price of gasoline, my husband's favorite milk, and my favorite bacon. So inflation certainly is a problem. As a matter of fact, today the Federal Reserve signaled that it could start reversing its pandemic stimulus policies in November and earlier than anticipated increase its interest rates. So thank you very much. Inflation is a problem related to too much money in an economy. And I think that we need to be mindful of our excessive spending. Thank you, Mr. Chair. I yield back.